Welcome to Psych Talk for Primary Care Providers, where our esteemed faculty members will provide you with invaluable insights to seamlessly integrate into your daily practice. Today, we will have Steve Delisi talk to you about ways to destigmatize addiction, just by rephrasing some of the words you say.
Hello, I'm Dr. Steve Delisi, and I'm the Chief Medical Officer for Your Path Care in St. Paul, Minnesota, and also on faculty with the Hazel and Betty Ford Graduate School of Addiction Studies. Really excited to talk with you about what's underneath the stigma around substance use disorders. It's an issue that we all face when trying to care for individuals who seek our care for substance use disorder. They've often been hurt and traumatized by prior experiences with healthcare, and they have an internalized stigma that's experienced as shame. So how do we understand that, and what can we do about that? Two of the central biases and beliefs that undergird stigma associated with any chronic illness are 2 points. One is the control bias, that people who have substance use disorder should be able to control their substance use. And the second is the cause bias, that they actively participated in causing their substance use disorder. The more someone believes that people cause their substance use disorder and can control their substance use, the more likely there's going to be stigma. And at a societal level, that is still true. And unfortunately, within our healthcare systems, these two central biases are also very common. What happens then is that the individual who's seeking care feels that they're being judged, that they're being marginalized and blamed for the illness that they're coming and seeking care for, right? So that becomes difficult. How does this get lived out? Well, one way, and a practical way, that we can really have an impact as healthcare professionals is in the language that we use when talking with our patients. Let me give you a practical example of this. Oftentimes, when we are treating individuals with alcohol use disorder and opioid use disorder, along the course of treatment, there are continued use of that substance. Also, when there's been a period of stopping use, frequently there is a return to use, something that we traditionally call a relapse. Everybody's heard, the person has relapsed. But let's unpack that term. Let's say we're treating Jim, and Jim is struggling with a cocaine use disorder. You've been helping him and working with him, and Jim hasn't been using cocaine for a couple of months. Jim comes into the office, maybe he's alone, maybe he's with his wife, and he tells you, "Doc, I relapsed." If we respond to Jim and his spouse in that same way and saying, "Jim, I hear that you've relapsed," what we've just done is we've reinforced that cause and control dyad of beliefs, right? Because where's the action? The action is on Jim. Jim relapsed on the cocaine, versus reframing it to, "Jim, I hear what you've been experiencing, and I'm sorry to hear that there's been a reemergence of symptoms with your cocaine use disorder. But we know that cocaine use disorder and other substance use disorders are chronic illnesses for many people. And return to use as a reemergence of symptoms of that chronic illness, that's something that we can address. And I'm here to help you with that." So you see, I've shifted it from the blame that Jim relapsed on the cocaine to now identifying that Jim has a severe cocaine use disorder, and there's been a reemergence of symptoms of that cocaine use disorder. Very similar to how we manage other chronic illnesses. Think about diabetes, right? We typically do not say to someone that they've relapsed with their hemoglobin A1C. What we say is there's been an elevation of the hemoglobin A1C, and that's evidencing a reemergence of active symptoms of their diabetes. And then we apply a change in the treatment. We can do the same with substance use disorders. And by identifying and recognizing these two core biases, we can have an active part in reframing what the person is experiencing, and it influences how their loved ones and their family members see and understand substance use disorder. And then I also just want to share that when I started in this field 25 years ago, I frequently would say that someone is relapsed, and I would even say they're a chronic relapser, right? Now again, what did I just do? I labeled that individual, and I'm blaming the individual for the ongoing illness that they have. I'm here to tell you that by changing that language, it's fundamentally changed how I view the patients that I treat now. I don't see Jim as a chronic relapser. I see Jim as someone who is suffering with a severe use disorder. And it really helps me to engage with Jim. And what I've noted is that it helps to facilitate that therapeutic alliance and that connection and that trust. Because again, people with a substance use disorder, they have internalized this stigma. They're blaming themselves, right? And that brings with it a lot of shame. And when they hear us as their healthcare professional talk differently, they start to think and see themselves differently. So I really encourage you to think about what we've talked about today and how much impact it can have on your care and view of patients with substance use disorder, and how it can help you to engage them and motivate them to pursue the treatment that can really lead to their healing and recovery. Thanks for listening.